hearing. You get some kind of special treatment, is what I can say, which of course is to the detriment of other people who might make noise. But many people just see that it's obvious and it's common sense for some people to have what we call positive discrimination. How is our justice system easily accessible? I will say that our justice system is not accessible to people living with disabilities. I know we still have courts that have stairs where people who have difficulty with movement cannot access, so that is like physical accessibility. We also do not have interpreters. They called sign language interpreters. We do not have them rolled out in the entire country. If I have someone who has a difficulty with speaking, I will have to be alerted about that case, and then I will have to source someone, that is if they are literate in signage. I have to source someone who can use sign language to interpret for me. What we are doing, local solutions to local problems, what we are doing right now is to investigate and find out, can this person sign, because there is a way people communicate in their communities. So we could look to see whether there is a family member who can sign for us, and so that we can understand what the person is speaking. What I can say is that is work in progress. There is still more activism to be done in that area. Why doesn't the justice system prioritize
Mudat. Okay, so in our next agenda, I would like to welcome Dr. Alan. Dr. Alan, a round of applause to Dr. Alan to give us his remarks and presentation. Please clap for him. Guys, you're from eating. You're from eating. Energy. We are young. Oh, we are young people. Please give me the energy as we welcome Dr. Alan. Let's clap until when he reaches the stage. Dr. Alan, you're welcome. Please, let's clap. We are young people. Let's clap until we reach, until he reaches the stage. Yes, Dr. Alan, you're welcome.
It's already afternoon. Good morning and good afternoon. Yes, it's always refreshing being amidst young people like you. Ladies and gentlemen, my name is Dr. Alan Kasozi, and I work in the Ministry of Health as a senior medical officer in the Division of Adolescent and School Health. I'm going to quickly be talking to you about health and the policy legal environment as it is currently. And I'll start with a small background to what we do at the Ministry of Health. So the Division of Adolescent and School Health was established in 2018 as a realization by the government that adolescent and young people's health is very, very important and critical to this country. If this division hadn't been established, then as a country we risked having young people's health issues getting lost into the general health issues of other people, older people. So this is a brief on the status of adolescent health and young people's health as it is. Uganda is a country that has one of the highest fertility rates, which stands at 5.2 children. So this means that on average, every woman will live to deliver about five children. We still have a high maternal mortality ratio. This means we are losing about 189 mothers per every 100,000 live births. But we are making very good progress on this because about 5 years ago, this number was about 336. When it comes to sexual debut means the age at which young people are going to have sex first. On average, this is 17, but of course it is different for the different districts. Some districts have a much lower or higher age of sexual debut. Looking across the room, some of the young people are saying, 17? Eh? 17 years is the average age a young person will have intercourse. in Uganda. Ladies and gentlemen, 34% of all children are already in marriage. That is up to 19 years, children up to 19 years. That does not make for a very good reading. But also, about 1 in every 10 of our young people are already using contraception because they're having sex, okay? Over the past so many years, close to 20 years, our teenage pregnancy rates have stagnated at around between 24 to 25. Findings from about a survey conducted about 3 years ago showed that 1 in 4 girls ages 15 to 19 years get pregnant. So if you're still a young person, please take care. Because when you get pregnant, you will not be able to achieve a lot of your dreams. And what are we doing at the ministry? There's quite a number of things that we do, but I've just summarized them generally into providing an enabling environment for young people to access and utilize services. Young people are largely healthy, by the way. Many of you in the room will look at yourselves and see the last time you went to a hospital, consulting or typhoid. It's very rare as a young person. Most of your issues are related to sexual reproductive health, mental health, substance use, okay? And lately, with these borders, injury prevention and violence, okay? So, our role here is to provide an enabling environment through enacting policies and laws that will enable you access services. But also we coordinate how these services are going to be provided. How do services reach the last person in the village who needs them? We also collaborate with a number of stakeholders, including you yourselves, to actively participate and meaningfully participate in the provision of these services. And then, because every dollar must make sense and have maximum impact, we provide these services in an integrated manner. And we reach young people wherever they are. Young people in schools, so we reach you with a package of health services. You are also on digital platforms like TikTok, like Tinder. Are you on Tinder? How about Grindr? The Gen Zs know what I'm talking about, eh? Yeah, so you're in schools, you are on digital platforms, health facility, you come to our health facilities, and if you're unable to be on all those in all those spaces, then we will reach out with outreaches, including vaccination, coming to your schools to provide services, circumcision, and all the like, okay? You might not be able to see all these services, but we provide a range of services all the way from the first health center, which is your family, from the village, through our VHTs, through providing information to your parents who are going to later on then talk to you, all the way up to the national referral system. So this is a package of services, but the font maybe you will not be able to see it. Largely, you have to demand for health information on GBV prevention, growth and development, recreational services, economic empowerment, life skills. I'm sure Commissioner from Ministry of Gender talked about some of these services. You also have to demand for health services, especially around counseling. Don't die with your problems. Kindly reach out to our health service providers to talk to you about any issues that might be giving you any form of mental distress. Some people in this room might not want me to talk about family planning for young people, but so I'll call it pregnancy prevention services. Demand and utilize pregnancy prevention services at the nearest health facility. That will include condoms and any other services, as the health worker will counsel you there. These services might be readily available, but there is still a lot of stigma, okay, that moves with some of these services. This has in a way hindered service uptake by young people. So for those of you who are still in school, there is also a prescribed school health care package that we bring to your schools, including basic curative services like first aid, health information on key issues like HIV, STDs, okay, through senior men, senior women, menstrual hygiene management, and all the other services as you got them when you're still in school. Nutrition, okay? We don't intend for our schools to be health facilities. So that's why most of the services that you see in schools are mainly preventive and promotive. We intend to prevent disease through empowering you with knowledge, information on how to prevent these diseases, but also for you to also have the agency to take care of your own health. If there are any diseases that need to be treated, then schools are encouraged to provide these curative services through linkages to a nearby health facility. So we, as a government, Ministry of Health, we are ratified on a number of global commitments to provide good health and your well-being, including all the way to the highest level at the UN. We're committed to providing good health and well-being to young people, focusing especially on universal coverage of these services, including sexual and reproductive health care. We're committed to gender equality, such things like the additional points you get as a girl entering university. You know that. You are eligible to that additional 1.5. I don't know whether you still have those points. Play on a leveled ground. There's a number of protocols, regional protocols that are there, all intended to provide good health and well-being for young people. So we also have a number of policies that we write as a program. Our program includes Ministry of Gender, Ministry of Health, as well as Ministry of Education. So there's a number of policies in place, but despite these policies being in place, we continue to see certain challenges, some challenges that will still hinder access to services and utilization of services by young people. We have the National Gender Policy, the Adolescent Health Policy Standards, policies on education, and the like. But the Constitution of Uganda is the supreme law of the land and provides broad legal frameworks for the protection and promotion of your rights and dignity. Every single right that you will need as a young person in this country is enshrined in the Constitution, okay? This takes me to a concern. Quite often you hear other players in the civil society space forwarding an agenda on rights, okay? But whenever that should happen, or if you are approached as a young person on the agenda of rights, kindly always revert back to the Constitution, which was written by your area member of parliament, okay? And try to find harmony between what the Constitution says and what the CSO is saying, okay? So, but all your rights are enshrined in the Constitution, and if there's any that you can identify that's not in the Constitution, then it's upon you and me to continue with the advocacy, to see to it on how this can be enacted. So, under the Constitution, we have the Penal Code Act, which creates quite a number of sexual offenses that are intended to protect vulnerable people, including children, from sexual abuse. We have provisions that define what defilement is, what rape is, and also the punishment should you fall a culprit or a perpetuator. It goes ahead to define other offenses against morality, which might include abduction, procurement or procuration, then procuring of defilement by threats, offenses against morality. Permitting of defilement, this was very interesting. If you're going to own a business, and your business owner, let's say you own a lodge, or any other premises, and a girl below 18 years is brought to your business premises for purposes of sexual intercourse, the law, the long arm of the law will catch you. They will say that you're permitting defilement, okay? Indecent assault and other provisions. We also have the Sexual Offences Act, which consolidates those laws relating to sexual offenses. But this is all intended to combat sexual violence against young people. It goes ahead to describe what these sexual offenses are. We have the Children's Act, which goes further to still describe what some of those offenses are against children and protect them against predators. We have the Public Health Act, which is ideally rules made under this Public Health Act. They require schools to ensure that learners or students study and play in healthy environments. If that doesn't happen, then you're going to end up with issues like TB in schools, UTIs, and the like, fires. However, most interestingly, we have the Local Government Act. This one provides for functions and duties of district local councils to implement all government policies. So, government has the policies, okay? The laws are in place. But implementation of services mainly occurs under the local governments, under cities, under district local governments. So, if you're going to do advocacy, if we need something changed, we know where to start from, bottom up, okay? At the Division of Adolescent and School Health, I felt this was important. We empower young people with a set of rights regarding their reproductive health and responsibilities, and these rights are in line with the other policies and laws of the land. A right is a claim or entitlement. Actually, it's an entitlement over something. A right is non-debatable. There are values and principles that you must demand for. So rights around reproductive health relate to personal decision-making and behavior, how you can also access appropriate information, and they also relate to guidance and services of sexual reproductive health in nature. So there is quite a number. I'll run through them. You have a right to be responsible for all aspects of your sexuality. You have a right to information and education about sexual and reproductive health. You have a right to gender equality and equity. You have a right to receive reproductive health services that are age appropriate. You have a right to feel comfortable when receiving services. You have a right when the time comes. We know that young people is anyone from the age of 10 to 24. That's how we define our young people at the ministry. So for as long as you're above 18 years, you have a right to freely choose a life partner. You also have a right to celibacy, like some of us. Celibacy, yes. Yes, it's been 2 weeks and 4 days and 3 hours since I exercised my right to. Then you also have a right to refuse marriage, okay? Yes, you have a right to refuse marriage. No one should force a young person into child marriage. But you also have a right to say no, including no to sex, including if you're already in union. Those of us at campus, weekend marriages. Eh? If your boyfriend is coercing, or if your girlfriend is coercing, you have a right to say no to sex, even if you're married. Then, with all rights comes responsibilities. You cannot go scot-free. You are also responsible to inquire about available reproductive health services in a nearby health facility. You are responsible to share correct information with your health service provider. Oftentimes, because of the nature of just being young, sometimes you feel judged by health workers, and this sometimes does not allow for you to give proper information. I've had consultations where a young person is grappling with an STI, but for you to get to know that actually this is an STI, it will be very difficult. She will come in, I have a headache, I have now my toes are also, you always move round and round like this. But it's your responsibility to what? To give and share correct information. For us, we'll ensure that you provide this information in confidentiality and privacy. Okay? You also have a responsibility to make an informed choice. All the decisions you will ever make, by the way, in a day you make close to 30,000 decisions. Not only as a young person, all of us, close to 30,000 decisions. The decision to either scratch your head or not to scratch your head, where you're going to sit, what you're going to have, how you're going to have it, those are all decisions. You have a responsibility to make only right decisions. Decisions that will enable you achieve your potential. If you make the wrong decisions as a young person, then it's not up to anyone else in future if the consequences are negative on your part. Decisions to drink alcohol or to stay pure. Decisions to put on a condom or not to. Because later on, if you don't put on a condom, you will die childless because of your earlier infections in adolescence. You might end up with blocked tubes or your testicles. Your sperm production might be affected because of a wrong decision you made at school to sleep with someone, to procure sex, or you might end up with the disease that will make you take medication for the rest of your life, okay? So, you have a responsibility to only and only make the right choices in regards to your health. You have a responsibility to consult your service provider if you're not feeling well, and also to follow instructions to medication, to healthcare, but also to use services correctly. You have a responsibility to use services correctly. Those of us at campus, can we have a discussion, a conversation around the use of morning after pills. Or I mind my own business. Can we talk about morning after pills? Can we talk about postina? You have a responsibility to use